Hi Stephanie, you're here today to do your catheter insertion checkoff. Your patient Davida is in the bed there next to you. Her orders are on the counter, and I'll be using your checklist to do the checkoff. Do you have any questions before we start?
Nope.
All right, so you can go ahead and begin.
All right. Okay, I have patient Davida Matthews. Her birth date is 3/3/1950. She has no known allergies. The orders read to insert a Foley catheter now for urinary retention and obtain a sterile urine specimen. And then if the catheter becomes plugged, may perform closed irrigation with 30 milliliters of sterile normal saline and leave the solution in the bladder for 1 minute. And I'm going to go in and introduce myself and make sure she's my patient. So, Davida, can you tell me your name and date of birth? Okay, that matches. And because she's a female, I know I'm generally going to need an extra person to help me out. I'm going to go around and get my privacy curtain and wash my hands. And Davida, today we need to put a catheter in because you haven't been able to void. Alright? Okay, now I have to make sure my bed rail is raised on this side and that my bed is up in the right position, which it is. And I'm going to uncover her a little bit so I can get this waterproof pad under her. And because I'm right-handed, I'm going to stand on the left side of her bed, and I'm going to get her in the proper position. She would lay on her back with her knees flexed, and then I drape the blanket over her in the diamond drape, and then I need to put on clean gloves. And just inspect the area to make sure that it's clean, and if not, then I would take a washcloth and make sure that everything is clean, and then I would have my assistant have some type of a flashlight if I needed it. So now that I make sure her perineal area is clean, I'm going to take my gloves off and wash my hands. And now I need to get my catheter kit out of the bag, noting the expiration date. This bag will become my garbage bag. And I open my catheter kit, and I gotta turn it this way. There we go. Keeping it sterile. Okay, and the trick with these kits is you gotta get to your gloves without getting it unsterile. Now I can pick up my sterile gloves. I'm going to take them over here. Make sure that doesn't fly back at me. This one on first. And now I totally unsterilized my glove.
But that's okay as long as the palm and fingers are.
Okay, now that I have my sterile gloves on, get rid of that. Okay, now I need to put my drapes on my client, and I need an assistant to help me do this. I can touch these sterile drapes because I'm sterile. I have to be careful not to touch anything else. And you put your thumbs on the corners and then roll. And then I'll have my assistant help me lift. Be careful not to touch anything with my gloves. And then this stripe goes Alright, now I can take my iodine. Wait, first I need to take my specimen cup, put the lid on, set it over here, and then I would take my iodine, put it on my cotton balls, and then throw this in here, making sure I don't touch my gloves to anything. And I take my lubricant, and I squirt it in the tray. Okay, I'm done with that. I can move the tray over, and I'm going to get the catheter out, which is this. And you have to carefully take the plastic sheath off without swinging your catheter around. And then you lubricate about 3 or 4 inches for a female. I can put that back. And I take my sterile water and I attach it to the balloon port. That's all set. And I take the whole kit and I bring it over here, being careful not to touch anything in the process. Alright, now I need to clean the area off. I take my non-dominant hand and just gently spread the labia part, and this hand stays there throughout the entire time. So I take my cotton balls with the betadine. First one goes right down the middle. Careful not to touch anything. And my second one, you go off to one side. And then the other. And right down the middle again. Now I can take this top tray off because I don't need it anymore. And I'm going to tell my patient that I'm going to insert the catheter now. Have her try to relax, and then you just slowly, right, and I would advance until I see urine flowing out, and then go another 1 to 2 inches. Okay, now I'm ready to inflate my balloon, so I can take my non-dominant hand and hold the catheter out here and let go with this hand. And I take the balloon and I just slowly start to inflate. And I'm watching my patient to see if she's having any pain.
Oh, she's having a lot of pain.
Okay, so I'm going to deflate my balloon by pulling my plunger back out. And then I'm going to insert the catheter with this hand another inch or 2. And then I'm going to try again with the balloon.
No pain this time.
Okay. So now I can inflate my balloon. Okay, to test to make sure my balloon is in place, I'm going to pull on it until I can feel some resistance. And once I feel that, I'm going to push the catheter back in. With this hand staying on the plunger at all times, because I have to keep pressure on it. There we go. Now I can let go of this hand because I know it's firmly in place, and take off my syringe. Okay, I'm done with the syringe. So now what I need to do is take my catheter bag out of the box, and I need to secure the catheter to her leg with some tape. And I want to make sure I give her enough slack so she can move around. and I attach the bag on the bed frame. Alright, now I need to get my specimen collection. So I come down here and I put my lid top side up so it's not contaminated. And I can only take it out of this port right now because I just placed the catheter. After this, it's considered contaminated. So then I put it in there. And that up there. And then I use an alcohol swab to clean off the tip. And then putting the lid on my specimen, making sure it stays sterile. Okay, now that I've got my catheter in place, I need to wash the peri area to get the betadine solution off. And then I would remove my drape, clean up my supplies.
You can actually remove your drape.
Okay. And to do that, you have to rip it.
And you can put all the supplies in the garbage.
Take off my gloves and wash my hands. Now I need to palpate the bladder and get my patient in a comfortable position and ask her how she's doing. Make sure her colloid's there and everything. And I'm going to look at, colloid's on the floor. I'm going to look at the catheter system, make sure that urine's draining, look at my color and type of urine and all that, and make sure that nothing's leaking. Now I'm ready to document my procedure. So I would go under here and I would document the type and the size of the catheter that I used, the amount of fluid that I used to inflate my balloon, the urine's characteristics and the amount, why I needed to catheterize, the specimen I collected, the client's response, any teaching I provided, and a start and intake and output record. And if I have the catheter in the bladder and I don't see any urine within an hour, I would need to report this immediately to the healthcare provider.
All right. Congratulations, Stephanie, you passed. Great work.
Thanks.
We would now like to show you the differences when catheterizing a male patient. First of all, the patient is lying supine with their legs straight, and you can actually keep the blanket on the legs, and your drape can go on top of the legs, and your kit can actually set right on top of the male patient's legs. The other difference comes when cleaning the patient, the male patient. If you have a male patient who is not circumcised, with your non-dominant hand you retract the foreskin just as Stephanie did. You then take your cotton swabs and you clean in a circular motion, starting at the meatus and working outward in a circular motion. She will then get another cotton ball and continue with that circular motion. You would keep doing this as much as needed to clean the penis, and then your last swipe would go right over the urethral meatus. Now Stephanie is ready to insert the catheter, and so again you hold the penis with a firm grasp in a perpendicular motion, and she will insert the catheter. In a male patient 7 to 9 inches, my rule of thumb is usually you insert until you see urine. Once you see urine, then you insert another 1 to 2 inches. And as you can see, often in a male, your catheter is in quite a ways. And then the remainder of the procedure is the same as for a female. Thank you.